send it around after the call as well, that basically says, look, paying based on a patient outcome, an improved patient outcome is pro-patient. We support that kind of an approach. So we're asking all groups to kind of sign on to that letter before the committee goes to markup, probably next week. If there's any questions about that, you can please just get in touch with me. We think at the end of the day that doing that, kind of an arrangement improves adherence. It improves targeting the right therapy to the right patient. And ultimately, if you're incenting a better patient outcome, you're getting to patient better care itself. So we just need to have a strong patient showing that shows the committee that, no, hey, the patient community is, in fact, behind this type of effort. It's one way to really address the growing influx of products on the market that are really more personalized and higher cost, and that is directly tied to a patient outcome. So we would appreciate all groups taking a look at the letter, signing on, and then happy to answer any questions about the package in general or value-based payments specifically.
Great. Thank you so much, Joel.
I'll be here all week.
Thank you for joining us today.
Of course. Thank you.
I'm going to turn it over to Kylie. Kylie actually just started with us a few months ago, and she's the Medical Food Policy Fellow with the National PKU Alliance. I'll give an update on the Medical Nutrition Equity Act. All right. Thank you, Shannon. Okay, so the Medical Nutrition Equity Act of 2019 has been reintroduced at the beginning of May into the House. Basically, it ensures that public and private insurance covers medically necessary foods and equipment required to prevent severe disabilities and death, so that children with inborn errors of metabolism or digestive conditions can become healthy, productive citizens. One of the conditions that it covers is phenylketonuria, or PKU for short, is what most people know it as. And basically what happens is these children and adults lack the amino acid that metabolizes protein into a useful substance to our bodies. So when they ingest chicken or protein from a normal diet that you or I would eat, it actually becomes toxic to their body, and they suffer severe brain damage, as well as intellectual disabilities. And so the treatment for it are these medical foods, which is what HR 2501 addresses. The current co-sponsors, we have 31 so far. We've got 27 Democrat as well as 4 Republican. The bill was introduced by Jim McGovern's office as well as Jamie Ferrer-Butler. As far as the Senate side, we've got one lead Democratic sponsor, Bob Casey, and we are looking to identify one Republican lead on that as well, potentially Senator Blackburn on that. It's yet to be confirmed, though. The status in the House is that it's in committee. And to take action, if you go on congress.gov and look at the list of the co-sponsors and you don't see your representative on there yet, we ask that you call your representative to request that they become a co-sponsor of HR 2501. And then if you have any questions or anything like that, my contact information is here. You can also find that at everylifefoundation.org. Great. Thank you so much, Kylie. Next, I'm going to pass it on to Patricia Egan. Patricia, are you on the line?
I am. Can you hear me?
Yes, we can.
Great. So thank you so much. This is an update on the Lymphedema Treatment Act, which has been working its way through Congress since the 113th Congress. Next slide, please. Next, okay. So the Act provides a Medicare benefit to cover compression materials such as garments and bandages, which are needed for the treatment and daily care and management of lymphedema. these are prescribed compression garments. They last about 6 months, and therefore they're not qualified per the current durable medical equipment guidelines. And we've gone through HHS since the 113th Congress, and the prior and current secretaries have all stated that because these garments and compression supplies do not qualify under the current statute and they cannot change the statute, Congress needs to act, and that's the reason why we have this bill. So lymphedema is associated with more than 40 rare diseases. I have hereditary lymphedema, so that's the reason I'm involved. And there is no FDA-approved pharmaceutical treatment. There's no cure, and compression is absolutely what every patient needs to work with every single day. Next slide, please. Next slide. Okay, so when we first started working on this bill, we got a lot of pushback. Oh, we don't support a single disease. And so our Congress about was that this is not a single disease. Primary lymphedema is either hereditary or its cause cannot be determined, and secondary, which is by far the largest amount of lymphedema cases, are caused by cancer treatment that impairs the lymphatic system or traumatic injury. Next slide, please. So the bill has been introduced in both the Senate and the House. We are very fortunate to have both bipartisan and bicameral support. Since as of yesterday afternoon, these numbers of co-sponsorship have actually been updated. We now have 302 co-sponsors in the House and 61 in the Senate. For anybody who hasn't yet done so, please take a moment to click on the RDLA Take Action Alert and ask your members of Congress to co-sponsor. We all know that the more co-sponsors that you can garner, the better your chance of visibility. Next slide, please. So the bill was reintroduced in the House by Senator Maria Cantwell in February, and then by Jan Schakowsky in March. As of today, we have 61 co-sponsors in the Senate, which actually is 83.3% of members of the Rare Disease Congressional Caucus. We have been very grateful to the Rare Disease Congressional Caucus for their support. And in the House, 302, I haven't recalculated all the numbers, but it's more than 77% of the caucus. Just for point of comparison, at the end of the 115th Congress, we had 66 co-sponsors in the Senate and 385 in the House, which made this bill the #1 co-sponsored healthcare bill. It was shy only of the STAR childhood cancer bill. So we were very highly rated, but we didn't get through the committee process. Next slide, please. So I just want to thank RDLA for all the support that you have given this act. You've included the legislation on the scorecard, Take Action Alerts, the Voter Voice app, and our advocates have been supported during Rare Disease Week and the Rare Voice Award. We'll also be participating in Rare Across America. One of the things that I love is being able to not just talk about one bill, but I can talk about all the other bills that Rare Disease Legislative Advocates is promoting. So thank you for your support, and I just want to give an update on this bill.
Great. Thank you so much, Patricia. I appreciate it, and thank you for all of your advocacy. Let me unmute Becky's phone. All right. Becky, I'm actually not able to unmute your phone for some reason. If you could, Becky, if you could call back in using the caller number, the attendee number from WebEx, then I'll be able to find you and unmute your phone. We'll go ahead and skip ahead and Steve, are you there?
I'm here.
All right, great. Steve will be presenting on the Newborn Screening Saves Lives Act. Thanks, Steve.
Thank you, Shannon. So just want to give a brief overview of the legislation. So the Newborn Screening Saves Lives Reauthorization Act will continue federal support for state newborn screening programs. And this legislation was originally passed in 2008. It was then reauthorized in 2014, and it will again need to be reauthorized before it expires at the end of September 2019. So that's why right now we're doing a major push to get this legislation enacted. Prior to passage of the bill in 2008, the number and quality of newborn screening tests varied greatly from state to state. In 2002, some states were screening for only 4 conditions, while others were screening for up to 36. Today, there's 44 states and the District of Columbia that require at least 29 of 31 treatable core conditions to be screened for. And these are the core conditions that are on the federal recommended uniform screening panel. That panel and that recommendation is made possible by this legislation. Early diagnosis for screen conditions is not only life-saving for many infants, but it's also cost-saving in many cases to the healthcare system. 1 in 300 infants has a condition that can be screened for, and we need to reauthorize this legislation so that the nearly 4 million babies born annually will continue to receive adequate screening, and so that we can continue to add conditions to be screened for. So now I'm going to get into just a little timeline of what's been going on. You can see that the House of Representatives, we've been moving along much more quickly than in the Senate, but we do have some, good news from the Senate that they're planning to introduce it soon. So on May 2nd, Representative Lucille Roybal-Allard, along with 3 original co-sponsors, introduced the legislation. It then had a hearing by the Energy and Commerce Committee's Health Subcommittee on June 25th. There was great testimony from Dr. Joseph Boschini, who was formerly the chairman of the advisory committee that actually adds those conditions to the RUSP. So an excellent expert to be giving testimony on that. Then on July 11th, the Energy and Commerce Committee's Health Subcommittee held a markup of the bill. They approved it by voice vote and added 1 amendment. And yesterday, we had the full Energy and Commerce Committee markup where they approved the bill by voice vote with no amendments. So right now in the House, the next step is for it to go to the full House of Representatives to have a vote and be passed in the House. So this is why it's so important that we need advocates to call their members of Congress and add co-sponsors, because the more co-sponsors that we have on the legislation, the easier argument that the sponsors of the bill have to ask leadership to bring it up for a vote. And in the Senate, we are moving along, but unfortunately a little bit more slowly. We're expecting Senators Cory Gardner and Maggie Hassan to introduce it in the Senate very soon. Once that happens, we do expect the Senate Health Committee to move the bill quickly through the process. So even though we're pretty close to the August recess, we are expecting right now that the Health Committee will have a markup of the bill before the August recess. One of the sticking points in the Senate that I think will make the process a bit slower than in the House is that Senator Rand Paul is expected to again offer a privacy amendment that would reduce the bill's effectiveness. And this is something that many of you who were involved in the last reauthorization in 2014 may remember. It did unfortunately hold up the bill from enactment. So we're going to be doing everything that we can to, work with Senator Paul's office, as well as any other senators that might have similar concerns to alleviate those concerns and, let them know why this legislation is so important and needs to move forward. Shannon, thank you for the next slide. So on the funding side, which, is very important, the legislation authorizes all of these programs. It makes very important updates to existing legislation, but without the appropriations, the money will not actually come from the federal government and fund a lot of these grant programs and other supports for states. So in the House, thanks to our sponsors, Ms. Werbel-Allard, Mike Simpson, Herrera Butler, and Kathleen Clark, who are all senior members on the House Appropriations Committee, we have some of the highest levels of funding ever in the House Appropriations bill for all of the various newborn screening programs at NIH, HRSA, and CDC. So great news on that front, and we're hoping that those numbers stay where they are when the Appropriations bill is ultimately enacted. The Senate Appropriations Committee hasn't come out with their bill that funds these programs yet. They are in a bit of a holding pattern right now until an overall budget agreement is reached between the House, Senate, and administration. And once that agreement is ultimately reached, we do expect the Senate to quickly come out with their appropriations bill. So it's important to let any senators that you talk to know that, you want them to co-sponsor the bill once it's introduced, but also that you support the House's funding levels. Some of them are on the Appropriations Committee and the Subcommittee that has jurisdiction over that funding and could really be instrumental in making sure that the Senate's numbers match the House's numbers. And so we try to make it easy for everyone to take action. You can go right to our website at rarescreening.org. You'll see an easy-to-use action alert. It's as easy as clicking, putting in your zip code. There's a pre-written message which you can edit, add your personal story, or leave as is, and click send. It'll take under a minute, and you can send it right to your members of Congress asking them to co-sponsor the legislation. There's also an option to make a phone call to your office, and there's a script for that as well if you would like to. Another opportunity, I know that registration has closed, but there's always an opportunity for people to get into meetings that have already been scheduled with your legislators. If you still want to join those for the Rare Across America meetings, that will be an opportunity to meet in person with your members of Congress so that you can tell them how important this legislation is. And we also recommend that you share these action items with your network. So take the link to our action alert and send it around to everyone in your network so that the calls to Congress and the emails to Congress are amplified even further. I can tell you from my experience as a health staffer on the Hill that the volume of calls and emails going to congressional offices is 100% the driver behind whether or not a member of Congress is going to co-sponsor that legislation. And the number of co-sponsors is the driver of whether or not these bills are actually taken up and voted on by the House and Senate and ultimately enacted. So we really do need this to be a grassroots effort with everyone calling in and emailing their members of Congress. I personally have called my member of Congress already, so I hope everyone on the line will do the same. And there's also the power of social media. We did a Rare Moms and Dads campaign during Mother's and Father's Day to highlight the importance of newborn screening, and we saw from that a 2,000% increase in the emails from advocates to members of Congress through our action alert that we've made. So please feel free to tweet at your members of Congress, tweet at friends and family in your network. Social media has seemed to have a very big impact in driving the message forward with members of Congress.
All right. Steve, we actually had...
And that's all from me.
Okay, we actually had a couple of questions here in the office and online, if you could answer them. You mind?
Sure. I'll do my best.
So one was the amendment offered during the Health Subcommittee hearing, if it was the Kelly amendment?
Yes, that was the amendment offered by Kelly and Hudson. This included a number of proposals offered by some industry members that are interested in the newborn screening bill and supportive of the legislation. We saw these from the kind of patient coalition side as non-controversial to the bill, something that we did not formally endorse, but that we did not oppose at all. So we were fine with that amendment being added to the legislation.
Another question is whether the Senate language will be the same as the House bill.
We do not expect the Senate language to be the same as the House bill. Right now, the draft language that's circulated is much more of a clean reauthorization. So the House, thanks to the great sponsor, Ms. Weibel-Allard, took into consideration a lot of recommendations from the coalition that Every Life and March of Dimes and other organizations have been part of to make important updates to the legislation. The Senate, we do think, is going to be much more of a clean reauthorization, so we'll probably be pushing more for the House language when they ultimately do conference.
Great. And then the last question is if you could explain the privacy amendment that might be offered by Senator Paul.
Sure. So when newborn screening occurs, that newborn screening blood spot can be used later for research, and it is completely anonymous the way it is used. But Senator Paul and Senator Cruz during the last reauthorization raised issues on privacy, and they wanted mothers to essentially opt in to allowing that newborn screening blood spot to be used instead of opting out. And, this really decreased the amount of samples that were able to be used for that vital research. So we are, okay with, and I'm speaking on behalf of Every Life, okay with, an opt-out type of situation, understanding those privacy concerns, but an opt-in during a kind of overwhelming, time in your life where there's a lot of paperwork and a lot of different pieces of information coming at you, we do think that will drastically decrease the amount of research that's able to be done, and we do see that research as being very vital for the rare disease community.
Great. Thank you so much. Thanks for letting me put you on the spot there at the end.
Of course, no problem. Thank you. And if anyone has any other questions, feel free to just email me directly over at Every Life, and I'm happy to answer them.
Great. And I've been able to unmute Becky's phone line, so I am going to go back to her slide so that she can present on the Ensuring Lasting Smiles. All right, go ahead, Becky.
Can you hear me okay?
Yes, we can.
Okay. Thank you, everybody. I appreciate being able to speak to you all today. I'm on Capitol Hill right now, so you might not be able to hear me very well. I'm in between meetings, so I'll try to make this a little quick. So I'm here today talking about the Ensuring Lasting Smiles Act, which is Senate Bill 560 or House of Representative Bill 1379, which was introduced during Rare Disease Week in February of this year. Next slide. So a little bit about the background. According to the Centers for Disease Control and Prevention, 1 in 33 babies in the United States is born with a congenital anomaly. Congenital anomalies include cleft lip, cleft palate, skin lesions, vascular anomalies, malformations of the ear, hand, and foot, and other craniofacial deformities. Our families who have ectodermal dysplasias are usually missing many of their teeth, and many of our families' children are missing all of their teeth. Although medical professionals and surgeons are able to correct many of these problems, some insurance companies deny access to care by labeling them cosmetic or non-functional in nature. Next slide. The Ensuring Lasting Smiles Act is federal legislation that would ensure that all private, group, and individual plans cover the medically necessary treatment, including the needed dental procedures to repair all congenital anomalies. It stipulates that such coverage includes services and procedures that functionally repair or restore any missing or abnormal body parts, and that also includes and specifies adjunctive dental, orthodontic, and prosthetic support and treatments, and it excludes cosmetic procedures or surgeries. Next slide. Senator Tammy Baldwin of Wisconsin and Senator Joni Ernst of Iowa introduced the Ensuring Lasting Smiles Act in the Senate, which is Senate Bill 560. We currently have 22 Senate co-sponsors, and we will be adding a couple more on soon. Our families are on Capitol Hill this week. We just had our advocacy day on the Hill yesterday, and we still have a few families who are advocating today. Representative Colin Peterson and Denver Riggleman introduced a bill in the House, which is H.R. 1379. We currently have 161 House co-sponsors, and we'll be adding to that as well. we have strong bipartisan support in both the House and the Senate. The Ensuring Lasting Smiles Act, as I had said, was reintroduced on 2/26. It was originally introduced last year in August, and the legislation is broad in scope, and it includes all congenital anomalies. It is not disease specific. Next slide. Here's a list of some of our supporters. We're thankful to have many different organizations on board, including Every Life Foundation, who's been a great supporter of the Ensuring Lasting Smiles Act, as well as supporting our Advocacy Day this year. Next slide. As far as a call to action, we're asking that all patient advocacy groups sign on to a letter of support for ELSA. There is a link available at the top of this page or this web slide. We're also asking if you are meeting with your legislators on Capitol Hill or participating in Rare Across America, which our organization is doing as well, to please ask your legislators to co-sponsor ELSA. As I had mentioned, this is our 3rd annual Advocacy Day on Capitol Hill this week, and if you would be willing to share our posts on social media or use the hashtag Ensuring Lasting Smiles to raise awareness and garner co-sponsorship, that would be great. And we're asking other patient organizations also to advocate for ELSA and send letters to their legislators to ask them to co-sponsor. If any of you do have a couple of minutes available today, if you would reach out to your legislators and call their offices and ask them to co-sponsor, that would be great. That would give our families a little bit of added support. And that's all I have. Thank you very much for everybody who has supported this legislation, and we're really gaining momentum in the last 5 months, and we hope to garner more support very soon. And once again, thank you very much for having me, and if you would like to reach out to me, my email address is Becky, BECKY, @nfed.org. Thank you, everybody, and have a good day.
Great. Thanks so much, Becky. Good luck on the Hill, and all of your work is really impressive. So thank you so much for sharing it with us. I'm going to skip back to where we were, and I'm going to give a quick update. This is Shannon von Felden. I guess I should have introduced myself at the beginning, Program Manager of RDLA. And I'm excited about the Rare Across America program that's coming up this summer in the month of August, where new and veteran advocates have the opportunity to meet with their legislators in the district close to their own homes. RDLA, if you're not familiar, we schedule the meetings for advocates in the district offices. It's free for advocates to participate, and RDLA does all the heavy lifting. The registration has closed. If you missed the boat on registration and you still want to participate, you can email me at sbonfelden@everylifefoundation.org. And the meetings are currently being scheduled, but we can attach you onto any pre-existing meetings that are scheduled. So if you want to participate, you can still contact me. There will be an informational webinar, training webinar on July 25th. If you haven't received communications about it and you're participating in Rare Across America, please email me as well. And if your availability changes, please do not contact the congressional offices themselves. We're scheduling the meetings for groups of advocates in most cases. So if your availability changes, please reach out to myself or Paola with Prime Advocacy, who is actually scheduling the meetings for us, and we can work out any scheduling issues you might have. I want to give a quick update. We have over 600 advocates signed up for Rare Across America from 49 states this summer. So we are going to hit a lot of offices and a lot of members during the month of August, and it's a great way to share bills that you or your organization are working on, just like Becky and Patricia, as well as during the training webinar, we will also discuss other legislation or legislative asks that you could ask as well during those meetings. But we're very excited that the participation is double the participation last year, So we're excited what that means to reaching more offices and more members and giving more advocates a voice during the month of August. So if you do have any questions, please feel free to email me at any time. So a housekeeping item is that our next RDLA meeting will be in September. We won't have a meeting in August. Washington, D.C. kind of empties out during that time, and we'll be busy with Rare Across America. But like at any other time throughout the year, if you have any topic that you yourself would like to present on or a topic that you're interested in learning more about, please feel free to reach out to me, and I'm happy to find a speaker on a particular topic or happy to give you the floor as well on our agenda. So please feel free to contact me. We're ending a little bit early today. Everyone was very succinct. So thank you for joining us, and let me know if you need anything. Thanks. Thank you. Thanks.